Have you ever wondered if all those health checkups they push on you after 60 are really helping? Or could they be quietly causing more harm than good? You see, after spending over 3 decades in medicine, I've watched a silent wave wash over our elderly community. A wave made of well-intended tests, screenings, and scans. But beneath it, fear, confusion, and sometimes irreversible consequences. This isn't fear-mongering, it's experience. And what I'm about to share with you could shift how you see your own health forever. Let's start from the beginning. You're 60, maybe 65. You're feeling mostly fine, maybe a little slower than you were at 40, but that's just life, right? You visit your doctor for a routine checkup and suddenly there's a barrage of suggestions. Let's just be safe, they say. Let's do a few precautionary tests. And before you know it, you're spiraling through hospital corridors for scans, blood work, stress tests, scopes, you name it. Sounds responsible, doesn't it? But here's the truth. Not all that glitters is gold, and not every test is worth taking. Let me tell you about Mr. Sharma. He was 68, retired engineer, fit, a regular morning walker, sharp mind. One day, his insurance plan offered a free full-body scan. Why not, he thought. What harm could it do? The scan picked up a tiny lesion on his lung, less than a centimeter. The doctors couldn't tell what it was, so they ordered more scans, a biopsy, and eventually surgery to remove part of the lung. The result? Benign scar tissue from a childhood infection. But the surgery left him breathless. His evening walks stopped. His confidence eroded, all for something that would have never affected him. This isn't rare. Full-body CT scans are often marketed as life-saving, but they can expose you to high radiation, sometimes more than 400 chest X-rays. They frequently detect harmless anomalies that trigger invasive follow-ups, and every follow-up carries risks, infection, bleeding, anxiety that steals your sleep. So ask yourself, if the test won't change the way you live today, is it really worth it? Then there's the infamous PSA test, a small blood test that checks for prostate-specific antigen levels, commonly used to detect prostate cancer. Sounds good, right? But here's what most men over 60 aren't told. Prostate cancer, in many cases, is slow-growing. So slow that you'll likely die with it, not from it. And the PSA test can't distinguish the aggressive ones from the harmless. A slightly high PSA score often leads to biopsies, uncomfortable, risky, and stressful. And if cancer is found, even a non-threatening one, panic kicks in. Surgeries and radiation follow, sometimes leading to lifelong issues like incontinence and sexual dysfunction. All because of a test that might have found something you didn't need to treat. Now let me talk to you about the carotid artery screening. This one checks the blood flow in your neck arteries. It sounds reasonable, right? Prevent a stroke before it happens. But here's the thing. Unless you've already had symptoms, like a mini stroke or sudden vision changes, these tests don't benefit the average elderly person. Why? Because even if a mild blockage is found, doctors might suggest procedures to clean the artery, like stenting or surgery. But those very procedures can cause strokes themselves. That's right. The test meant to protect you can actually increase your risk. It's like trying to fix a window with a hammer. You might shatter it instead. Let's not forget bone density scans. Women especially are often told they need this as soon as they hit menopause. And if your T-score isn't perfect, they'll start you on bone-strengthening meds. But those drugs, called bisphosphonates, can have intense side effects. One of my patients, Mrs. Kulkarni, was 70 when she was told her bone scan was borderline. No fractures, no history of falls, just one scan. She was put on medication. A year later, she couldn't chew properly. Diagnosis? Osteonecrosis of the jaw, a side effect of the very medicine meant to protect her. The bone had started to die. And for what? A number on a report. Heart stress tests are another common trap, especially before non-cardiac surgeries. You're scheduled for a knee replacement or cataract surgery, and your doctor says, let's just check your heart. Next thing you know, you're doing a treadmill test or a nuclear stress test. And if there's an abnormality, you're whisked into the cath lab, angiograms, possibly a stent. But did you know that in people without chest pain, stents do not lower the chance of a heart attack or help you live longer? Yet this is routine. I had one gentleman, Mr. Bose, who went in for a hernia repair and ended up with a stent. He didn't need it. 6 months later, he had complications from blood thinners. His hernia was never even repaired. Colonoscopy. Now this one has saved lives. I won't deny that. If you're between 50 to 75 and haven't had one before, yes, it's worth considering. But if your last colonoscopy was clear and you're in your late 70s or older, repeating it may do more harm than good. The risks of bowel perforation, bleeding, and complications from anesthesia rise with age, yet many are put on a 5-year repeat cycle regardless. One of my patients in his 80s suffered internal bleeding after an unnecessary follow-up colonoscopy. It took weeks for him to recover. And then we come to blood tests, the most routine, most accepted part of checkups. But here's where nuance matters. When you're older, small fluctuations in blood sugar, cholesterol, or liver enzymes are normal. Your body isn't 30 anymore, but often these small changes are flagged as diseases. You're pre-diabetic. Your liver is fatty. Let's repeat these in 3 months. And so begins the cycle of worry and overtreatment. What was just a seasonal change or a minor variation becomes a label you carry and sometimes medicate unnecessarily. You might be thinking, if not these, then what? Are we supposed to ignore our health? But medicine is about context, about treating the person, not just the paper. The key is asking, what symptoms do I have? What's my history? What will this test really change? Will it make me live longer or just worry more? Preventive health is important, but over-testing isn't the answer. We must aim for wise testing. Testing that's backed by your condition, not your age alone. Your time is precious. Your peace of mind matters. If a test can't change your treatment plan, maybe it's not worth doing. Maybe, just maybe, it's okay to say, I'm good. Let's wait. So here's what I tell my patients, and now I'm telling you. Don't blindly say yes to every test. Ask questions. Seek second opinions. If you're being tested for something you don't have symptoms for, ask, what will this result change? And if the answer is nothing, walk away with confidence. You deserve a healthcare plan tailored to you, not your age group. You deserve decisions rooted in science, not fear. And most of all, you deserve to live these golden years with clarity, not confusion. If you found this valuable, pass it along to your friends, your parents, your neighbors. Start a conversation. Let's change the narrative around aging and health. Let's replace fear with informed choices, because aging isn't a disease, it's a journey, and you should be in control of how you walk it. Stick around. More insights like this are coming, but for now, breathe easy. Sometimes the best thing you can do for your health is to say no.